Men's health often slips into silence. And to have that conversation today on the Ndtv Lifeline podcast, joining me is Dr. Vikram Sharma. He's the Director, Urology, Head of Robotic Urological Surgery, FMRI, Gurgaon. I think it's really important we need to honestly talk about issues that affect a man's life, whether it's the heart, whether it's the prostate, and why they're really ignoring their health. Thank you so much, Dr. Sharma, for joining us today.
Pleasure to be here.
Before we get into the medical conversation, do you really feel that men ignore their health till it's really late and they only come when there is a problem?
Well, that has been true over the years, although I feel the scenario is changing a little bit now. Men are a little more forthcoming with their problems. I think the entire landscape has changed. So men understand their problems and they're more willing to come forward and meet doctors about it.
अगर मैं आपसे पूछूं कि men have a lot of stress, right? I mean, so do women. I would not say that as a woman. I mean, it's the same thing. But कहीं ना कहीं the upbringing is such, the setting is such कि आदमियों को जाने की ज़रूरत नहीं है. They are made stronger. Is that something you still see in today's day and age? क्या वो सच है?
Well, that also has been around for a long time. Men are inherently more stoic. They feel that showing any sign of discomfort or pain or medical issues is a sign of weakness. पर वो थोड़ा change हो रहा है. Men are more willing to seek remedies for a problem that they are more open to discussing.
Okay, so Dr. Sharma, many men prioritize work, they prioritize fitness, they prioritize appearance as well, कि हम जिम जाएंगे पतले लगेंगे, baldness के लिए बालों के लिए कुछ करेंगे. पर जब सेहत की बात आती है, especially if I can actually use the term when it comes to health under the belt, somewhere they ignore it. Is that true?
Yes, absolutely, that is true because somehow our upbringing, particularly in the Indian setup, in the Indian family setup, problems below the belt have more or less been brushed under the carpet, and they would much rather stay with it they would much rather discuss it with their friends than go to their parents or go to their contemporaries or go to a doctor. So because of that, a lot of myths have been perpetuated. बहुत सारी गलतफहमियां इन लोगों के minds में होती हैं. But again, like I said, I see it changing now.
अगर आप हार्ट हेल्थ की बात करें, आई नो you're the expert when it comes to urology, but obviously it's all connected. At the end of the day, आप एक डॉक्टर हैं. हम कहीं ना कहीं फटीक देखते हैं, और आदमी सोचता है I'll slow down, but rather than taking action कि नहीं मैं डॉक्टर के पास जाऊँ, do you also see that?
The heart is connected in a way to men's health also because हालांकि उनका कोई डायरेक्ट रिलेशन नहीं है आपस में, पर फिर भी जो बीमारियां हार्ट को इफ़ेक्ट कर रही हैं वही बीमारियां बाकी सारे ऑर्गन्स को भी इफ़ेक्ट कर रही हैं. बिकॉज हार्ट में अगर ब्लड पूरा नहीं जा रहा है तो द सेम deficiency in circulation is going to be impacting the kidneys, the prostate, the bladder, male genital organs. So the common underlying factor is the same.
What are the common factors that men dismiss as normal, but as a doctor they worry you? They dismiss it कि हाँ ये मेरे लिए normal है, लेकिन आपको वो शायद factors या symptoms आपके लिए worrisome लगते हैं for a patient.
So what has happened is that it's been told to men over the years कि जैसे जैसे उम्र बढ़ेगी वैसे वैसे यूरिन का फ्लो कम होगा, थोड़ी सी कमज़ोरी आएगी, there will be a little bit of sexual weakness and everything. So while that is true, there is a little slowdown with aging, but it can be addressed and it can be remedied with medicines, with lifestyle changes and paying a little more attention to your overall health. तो इन सब चीज़ों का अगर लोग ख्याल रखेंगे तो बीमारियां वहीं पे रुक सकती हैं. But the thing is that people need to be aware of what's going on with their bodies. They need to be in touch with themselves, and wherever they feel that something is not right, they should go and seek medical attention.
So for you, what would you say the red flag is? That the person, the man at this point should come and visit you.
So any change in pattern of urination, that is the most important thing. Agar frequency increase ho gayi hai, if they have to go more frequently to the washroom, if there's any kind of burning or pain, obviously blood in the urine is a very, very important sign which we take very seriously. So these are major red flags.
And agar hum sexual health ki baat kare, this is something men don't really speak about, again because it's either fear or it's embarrassment. And again, when it comes to prostate health, do you think Is it a myth that khali 60 years ke baad one needs to get their prostate screen, or do you see ki youngsters ko bhi, when it comes to prostate health, there could be a problem?
No, in youngsters, it's not really a problem because the prostate is an organ that's present in every man, and it's only after the age of 45 years that it really begins to increase in size. And it approximately doubles in size every 10 years. So from the age of about 50 onwards is when they should start being aware of their symptoms, their urination and everything, and start getting screened.
Again, you said we need to be careful about frequent urination. Is that also, just going back, I was just thinking, is it only at night or is it during the day as well? Because there's a lot of people say it's the night that matters, right? So your take on that?
No, the increase in frequency will be throughout the day and night. But yes, nighttime frequency is more prevalent.
And when does it become a harmless, when do you think one needs to go to a doctor? How frequent is that?
So when it has any kind of impact on quality of life, because that is one of the major parameters that we look at. That if you have to get out of a meeting to go and use the washroom, come back into the meeting, that definitely is a problem. Or if you're getting up so many times in the night that it's disrupting your sleep and you're dopey all day next day, so that is a quality of life issue. So these are times when the problem is starting to get serious and we need to look into it.
Okay, now just coming to the taboo conversation, जैसे महिलाओं में हम menstruation की बात करते हैं या menopause की, अभी भी unfortunately हमारे देश में it is a taboo topic. And when it comes to erectile dysfunction, again, we're not openly talking about it. Is that a standalone problem, or is that also a clue for prostate issues or something to do with your urinary or even the heart? Are they all linked? And how much of that have you seen in your clinic? How many people are really suffering in silence when it comes to ED?
So male sexual health is really not related to the prostate, to the heart most definitely, because problems with erections, erectile dysfunction is basically a circulation problem, which is more or less what the heart is also. जब heart में proper blood की circulation नहीं होगी, तभी heart के issues arise होते हैं, and the same thing happens in the genital organs also. But if we come back to overall male sexual dysfunction, it's of two basic types. There are problems with erections and there are problems with ejaculation. So premature ejaculation is another major entity and which is more prevalent in young men. And erectile dysfunction we find more in the elderly age group. So these are two completely diverse.
And when you say elderly, what age?
From the age of about 45 onwards. In young men also we find erectile dysfunction, but that is where, coming back to what you said about them looking good, they tend to use a lot of hair products, to make the hair more dense, or they've had hair transplants or something. They end up taking certain chemicals which interfere with erections. Minoxidil and finasteride, these are the two commoner ones.
So it's appearance versus, of course, something which is very important. लेकिन आपने इतने अपने years में, what kind of, issues have you seen with men? You were also telling me it affects the married life, of course, when it comes to ED. So are there medicines for this? Can this be treated, or are they just suffering in silence, which is impacting their married life as well?
This is the thing. They don't need to suffer in silence because each and every single one of these conditions is treatable. And yes, as we discussed earlier, that I have seen a lot of marriages break up because of sexual incompatibility. And it's extremely unfortunate because if they'd sought help earlier and if the problem was fixed, the partners would still be together. So I very strongly encourage people to come out and talk about it, if not with their peers, if not with their contemporaries, at least with a doctor one-on-one.
The other thing, Dr. Vikram, PSA numbers, coming back to prostate की अगर हम बात करें, PSA numbers create a lot of panic. आप उसके बारे में अगर explain करें, how does one interpret those numbers, each one to their own, उसके बारे में please थोड़ा हमें बताइए.
Sure. Now, PSA is a very unique enzyme. It's a protein that is secreted by the prostate gland. And anything that will irritate the prostate will cause a surge in the PSA. The commonest condition which causes a rise in PSA, we all know, is prostate cancer. But not every PSA rise is cancer. PSA can rise in infections of the prostate. It can happen if you've done a lot of exercise, which causes pressure on the prostate. Stationary cycling being one of them. If you give a blood sample after 1 hour of stationary cycling, you'll find a huge rise in PSA. So we don't get really excited every time we see a high PSA. It just makes us aware, and we need to look into it a little deeper.
And आपको कहीं ना कहीं लगता है कि men are scared to get the test done of the prostate, rather than कि disease itself, कि इतनी test में अगर कुछ आ जाए, क्या आपको वो fear factor दिखता है?
100%. This is the ostrich mentality that we're trying to fight all the time. To tell them, get tested, because if you get tested and if something abnormal comes, we have picked it up early and we'll be able to treat it that much better.
And जब आप treatment की बात करें, Dr. Sharma, does any issue with the prostate always need surgery, or does it need surgery, or there is medication as well for it?
Not at all. बहुत सारे prostate के patients जो present करते हैं problems के साथ, उनमें surgery की ज़रूरत नहीं होती. In fact, I would say we end up operating only about 20% of patients who have enlarged prostates. The rest of them are managed with medicines. Agreed, they need to take medicines for the rest of their lives, like blood pressure की medicine, diabetes की medicine, lifelong चलती है.
तो जैसे जो normal body की दवाई अगर कोई चल रही है, तो it is just a normal medication like that.
Yeah, absolutely.
और अगर हम lifestyle की बात करें and men's health, since this whole conversation is about men's health and they very often silence में वो suffer करते हैं, तो खाना या घर का खाना कितना impact लाता है on their overall health, specifically prostate health? And reproductive health, let me put it that way.
Yeah, so a balanced diet is very important for all systems of the body, and that's true for the urinary system and the reproductive system also. Good healthy greens, a balanced diet of carbohydrates, proteins and fats is very, very important, which is not to say कि आप बाहर जाके छोले भटूरे नहीं खा सकते. By all means, you don't need to deprive yourself, but by and large, you need to have proper home-cooked food, greens, green leafy vegetables, a little bit of nuts and seeds. All of these are very beneficial for the urinary tract.
And what about exercise? Again, when we talk about lifestyle, when, in fact, as part of the show, we'd also spoken to Dr. Vinayak, and when we talk about heart health, when we talk about sugar, we've got Dr. Mishra who's spoken about it, So, basic, obviously, lifestyle एक बहुत important role play करती है. आपने खाने के बारे में बताया. Exercise, men के लिए, खासकर when it comes again to the prostate, the other functions of a man, how important is exercise? And what kind of exercises do you recommend, if any?
So here's the thing. It's all about balance. Exercise is very important because, number one, it'll help you remain fit. It increases your circulation, and proper blood flow to all the organs is very important for overall health and fitness. And same is true for the urinary tract and the genital organs as well. But the other thing is you don't need to overdo it, because if you're overdoing it, you're doing muscle breakdown, you're doing, if you go into excessive, obsessive kind of exercise, it can actually be counterproductive. But yes, exercise is very important, because obesity, being overweight and everything, this has a direct impact on sexual health and on prostate health.
Okay. And I want to ask you about the symptoms. आपने हमें symptoms ज़रूर बताए थे, लेकिन कई painless symptoms भी होते जो मैं पढ़ रही थी. So are these painless symptoms even more problematic or riskier than the symptoms which come with pain?
This is the difference between a heart condition and a urinary condition. A heart condition will hit you suddenly. You'll immediately get a pain in the chest and you know something is wrong. The problem with the urinary tract is that everything is very slowly progressive. So what starts off as a slight variation in your urinary pattern and everything will go on progressing, and it doesn't really register in your mind. So this is something that men need to watch out for. Be very aware of what's going on with them. The others are occasional burning in the urine. A lot of patients come and tell me burning शुरू हुई थोड़ी सी, हमको लगा हमने पानी कम पिया है तो पानी बढ़ा दिया, उससे थोड़े दिन के लिए चली गई फिर आ गई. But what they're doing is they're masking a silent urinary infection. A little blood in the urine, a slight color change may not manifest as red in the urine. It may just manifest as a cloudiness or a slight haziness in the urine. So any change in pattern, any change in appearance and everything needs to be.
And the other thing, when we talk about urinary infections, ज़्यादातर वो एक औरतों की problem. When we say UTIs, obviously it's more common in women. How common is it when it comes to men? And do you feel, again, men, like you said, हम पानी ज़्यादा पी लेंगे, is warded off, right? Maybe the symptoms are painless or lesser compared to women. Is it common again, UTIs in men?
Yeah, men do get UTIs, but like you said, I agree with you, not as much as women do because it's the way they're made that they're more prone to urinary infections. But yes, men do get infections also. The only thing is that in men, if they present with a urinary infection more than once, we must look for an underlying cause. That is telling us there's something wrong inside. In women, we know it could be because of myriad reasons that are insignificant. But when men, it could be the manifestation of a serious underlying problem. So we need to look into it.
Okay, just coming to the term prostate cancer. Just the term cancer, that the C word kind of throws anybody off, the chair. How do you deal with patients? Because it's a common thing, India mein prostate, and it's very curable. लेकिन वो एक बार जब सुनते हैं term cancer, how are you dealing with your patients when you tell them it is cancer?
So the important thing with prostate cancer is, like I tell my patients, it's the most friendly cancer you can possibly have. Because if we pick it up in time, it can be cured. उसको पूरी तरह से हम ख़त्म कर सकते हैं in the sense कि वो we don't even need to screen for it anymore. But the important thing is to pick it up early, because if we pick it up late and if it goes beyond a certain step, then there's nothing we can do about it. So we tell the patients, keep getting screened, keep getting your tests done regularly, because the earlier we pick it up, the better it's going to be for both of us.
So screening, tests, of course, which you said, screening, tests, lifestyle, which includes your food, exercise. If you have to tell our viewers a habit for their well-being, overall well-being for men, whether it's the prostate, whether it's, dealing with anything below the belt, what would that be?
Avoid all known risk factors for all cancers, which are smoking, drug use, alcohol, recreational drug abuse, a healthy lifestyle, exercise. All of these are very important things for all cancers, particularly true for prostate cancer. Prostate cancer, the biggest problem is it's absolutely silent. It has no symptoms. The only time it produces symptoms is when it's too late. So we need to pick it up at an early stage. So screening is very, very important.
And overall, since this whole conversation is that how men, silence may they suffer when it comes to their health, right? They don't prioritize their health. They're busy, working for their families and doing so much more, which they feel is more important. That's why I said use the term prioritize. Stress. How important a role does that play in creating havoc in a man's life?
Huge. Stress has a huge role to play in both urinary symptoms and in sexual health symptoms, because stress is going to mess up with the urinary pattern. Of course, you know that every time you're under stress, you will go to the washroom more frequently.
Urges
because
there, yeah.
Yes, the bladder will want to contract that much more frequently. Similarly, with sexual function, stress will cause a reduction in the chemicals that are responsible for a normal erection. So stress is a big, big game changer for both.
And how does one manage stress? What do you tell your patients कि आप ऐसे stress manage कीजिए? Because very important reasons they need to manage stress.
So as far as I'm concerned, I tell them I can fix you, but if you've got major stress issues, I refer them to my counselors.
So Dr. Sharma, screening की अगर हम बात करें, what is the right age कि a person starts screening for themselves when it comes to prostate health?
आइडियल सिचुएशन में तो स्क्रीनिंग 40 इयर्स की एज से शुरू हो जानी चाहिए
जी.
बट बहुत सारे केसेस में लगता है कि 40 इयर्स में अगर स्क्रीनिंग शुरू कर रहे हैं तो हर साल टेस्ट करवाने की रियली ज़रूरत नहीं है. 50 इयर्स की एज के बाद हर साल एक बेसिक प्रोफाइल टेस्ट की करवा लेनी चाहिए. बिटवीन 40 एंड 50 साल, 2 साल में एक बारी, 3 साल में एक बारी एक पैटर्न बनना चाहिए. द आइडिया बीइंग शुरू में जितनी जल्दी हो सके लाइफ में, 40 इयर्स इज़ द बेस्ट, बट जिस एज में एक बेसलाइन इस्टेब्लिश हो जाती है आपके नॉर्मल रिपोर्ट्स की, तो उतनी ही जल्दी उसमें कोई वेरिएशन आएगी तो वो पिकअप हो जाएगा. तो एक बेसलाइन बनाना 40 इयर्स की एज में बड़ा ज़रूरी.
So that's where it can help, yeah. Well, thank you so much. I think it's such a critical conversation, which was an uncomfortable conversation, I think, to begin with, to be honest, because we don't have these conversations, right? But men's health is equally important. I don't think they need to suffer in silence. It's high time we speak about their issues as well, because at the end of the day, they're only making themselves vulnerable. Thank you so much, Dr. Sharma, for speaking with us.
Thank you for having me over.
Thank you.
Thank you.